My name is Dr. Riley Kulm. I'm a chiropractor at Mile High Spine and Sport. And in today's video, I'm going to be talking to you about the basic lab work or blood work you should be getting as a male. Now, in Colorado, it's actually within the scope of practice for chiropractors to order blood work for our patients. And one of my passions and areas that I really like to help my male patients with is testosterone optimization. I think there's a lot of misinformation out there about testosterone and strategies for fixing testosterone levels if they're low. It seems like, and this is based on many patients who come to see me as new patients, that they might order some testosterone blood work with their primary care physician. They'll see that total testosterone is under 300 and they'll be put on testosterone replacement therapy. Now, today's video is not a discussion on the pros and cons of testosterone replacement therapy. I just would like to explain that there are some very natural ways using lifestyle modification, supplements, dietary changes, workout changes that you can significantly affect those testosterone levels. Now, when it comes to ordering blood work as a male, I think a really fundamental place is to start with your testosterone panel, okay? Testosterone is what gives a man energy. It helps us be confident in our careers, in our lives. It helps us be good husbands and fathers. Having adequate testosterone level is the most important thing for a man's health. When you're ordering blood work for testosterone, I suggest most of my patients, once they are about 25 years old, we should start getting that done every 6 months or every year, okay? When ordering a testosterone panel, it's important that we get the full testosterone panel. Oftentimes, the only number that's looked at is the total testosterone. That's the number you hear a lot of people talk about. Is it 300? Is it 500? Is it 800? Is it 1200? This is a very helpful number to get, but it only gives us a piece of the puzzle. We also want to get what's called free testosterone and bioavailable testosterone, because only about 1 to 3% of that total testosterone is actually unbound to proteins and available to your muscle tissues, to your brain, to your reproductive organs. Yes, what is that total testosterone level? How much is your body producing? But we also need to see what the free testosterone, what the bioavailable testosterone is, because the majority of your testosterone is actually bound to proteins that transport your testosterone throughout the body. The two main proteins that transport testosterone throughout the body are sex hormone binding globulin, SHBG, and albumin. So these are the two other markers that we see on that testosterone panel, is your SHBG and your albumin. If either of those are too high, we're going to see that our total testosterone is not fully being available to our tissues because too much of it is bound to those proteins. So in summary, we have to get the whole testosterone panel that measures total testosterone, free testosterone, bioavailable testosterone, sex hormone binding globulin, and albumin. If any of those levels are off, we have different functional medicine protocols that we can use to help get those numbers where they need to be. Next up, we also like to check the two main things that testosterone can be over-converted to. The first one is estradiol. This is E2. This is one of the very strong estrogens that can be in our body. And contrary to popular belief, men have estrogen just like women, but we need to obviously make sure that it's not too high. There's an enzyme called aromatase enzyme that converts your testosterone into estrogen. And if that aromatase enzyme is overactive, we're going to have overconversion of that testosterone into estrogen, and the man may start to develop some female characteristics, which we obviously do not want. The other derivative of testosterone that it can be overconverted to is DHT, or dihydrotestosterone. That conversion from testosterone into DHT is catalyzed by an enzyme called 5-alpha reductase. And we also want to make sure that we're not over-converting testosterone into DHT. This can cause negative effects such as hair loss or excessive acne development. We want to have a healthy amount of DHT because it's actually a very strong androgen, about 10 times stronger than testosterone. So it's important to have, a normal DHT level, but if that DHT is through the roof, then we might be getting some negative effects from that as well, okay? So the full testosterone panel, the estradiol, the DHT, that's really like where we like to start with our basic lab testing for the hormones in men. When it comes to things that indirectly affect those hormones, I always order a lipid panel, which measures your HDL, your LDL, and your triglycerides. And you might be surprised, I actually order this because I want to see that that total cholesterol is actually high enough that we can produce all of our steroid hormones. Because our steroid hormones, including testosterone, estrogen, those hormones are actually made from cholesterol building blocks. So if our cholesterol is too low, okay, which Western medicine may consider as a positive thing, we're actually gonna be decreasing the amount of testosterone that we're actually making. So I actually like to see that my patient's total cholesterol is at or near 200. And of course, we want to maintain proper ratios between our HDL and your LDL. Having a requisitely high cholesterol level is actually very good for hormonal production. I have a lot of new patients that come to see me that are on a class of drug called statins, which I'm sure many of you have heard of. These statin drugs are very effective at lowering our LDL. Unfortunately, a lot of these same patients are having to be on testosterone replacement therapy, and part of that issue may be because they're taking a medication that's lowering the concentration of that LDL building block for testosterone. We actually need good cholesterol in our body for a variety of things, but testosterone production is one of those main things. Another marker I really like to order on my male patients is vitamin B12. Vitamin B12 deficiency is very common among men. Men typically trend towards vitamin B12 deficiency, while women typically trend more towards iron deficiency, which can lead to anemias. For men, vitamin B12 deficiency can result in a variety of neuropsychiatric changes, as well as putting you at greater risk for things like peripheral neuropathies. Vitamin B12 is very important for the functioning of our nerves and our nervous system as a whole. Also very important to check on a male health panel is vitamin D. I regularly see that low vitamin D levels correlate with low testosterone levels. So I always like to see that that vitamin D is in that 40 to 60 range, probably closer to that 50, 60, 65 range is where we like to see it from a functional medicine perspective. Vitamin D is important for all people, but especially for men that are trying to optimize their testosterone levels. Of course, we're going to order a complete blood count as well as a comprehensive metabolic panel. I really like ordering the comprehensive metabolic panel because it does include that morning fasting glucose. And we know that if we have insulin resistance or blood sugar regulation issues, we're going to have excess storage of fat in our body, and fat is one of the main activators of that aromatase enzyme that I talked about earlier, which will convert your testosterone into your estrogen. So men, here's just even more motivation to cut down on your sugar. If you have too much sugar, your body's going to store it as fat. If your body's holding extra fat, your aromatase enzyme is going to be acting through the roof, and you're going to be converting lots of your testosterone into estrogen. That's pretty much what I like to do from a baseline level. Of course, we have more specialized tests, such as looking at your omega-3 to omega-6s, looking at things like homocysteine, C-reactive protein, measures of inflammation in the body. These can be all very effective and important to check from a functional medicine perspective. But the tests I mentioned, those are really the baseline fundamental tests you want to get as a male. Like I said, starting at age 25, every 6 months, at the least every 12 months, we should be checking those levels and making sure that we're getting, where we need to be with our testosterone levels. Most men, we should be in that 800 to 1,000. That total testosterone, our SHBG and albumin should not be too high, so there's a strong amount of free and bioavailable testosterone, so we're feeling our best every single day. And like I said, if these levels are not where they need to be, we have different functional medicine protocols that we can utilize to optimize all of those levels. If you have any questions or comments, you can leave it in the section here. I didn't get specifically into all of the levels that we like to see from our functional or optimal ranges, but if you have questions about those, I can help you with those levels as well. Okay, thanks for listening today, and we'll talk to you soon.